Chapter 3, page 39, Part 2. Reading. Designer Baby Transplant. A British boy with a rare blood disorder may be saved by his designer baby brother. When Jason and Michelle Whitaker were told that their son Charlie had a rare blood condition, they were devastated. The doctor said that Charlie's only hope for surviving diamond black fan anemia was a stem cell transplant. The Whitakers and their daughter Emily were tested, but none of them qualified as a suitable candidate to help Charlie. They were not a close enough genetic match. That's when the couple decided to have another child. The Whitakers, who are British, asked the government for permission to use in vitro fertilization to create and select an embryo that would be a match for Charlie. When permission was denied, the Whitakers went to the United States, where such procedures are not illegal. Charlie's newest sibling, Jamie, was born after being selected from a number of embryos as a perfect genetic match. Blood was collected from his umbilical cord to be used for Charlie's transplant. The Whitakers have to wait until Jamie is 6 months old to make sure that he does not have the same blood disease as Charlie before the stem cell transplant can be done. Controversy. According to the Whitakers, they just did what they had to do to save their child. However, others do not agree. There's been considerable argument in the United Kingdom about the selecting of embryos. Critics worry that such selection could lead to babies being created to provide spare parts. But the boy's father, Jason Whitaker, said there was no selection on the basis of color of eyes or hair or sex. All we did was change the odds from a 1 in 4 chance of a match from a baby conceived naturally to a 98% chance. Sometimes the line between the permissible and the impermissible is difficult to see. Last year, the British government gave another couple, Shahana and Raj Hashmi, permission to test their unborn child to make sure her tissue would be a suitable match for their 4-year-old son, Zain, who suffers from a rare blood disorder. Neither the couple nor their 4 other children were bone marrow matches for Zain, who was expected to die without a transplant. In the Hashimi's case, the boy's illness was hereditary. Screening the new baby would be necessary anyway to ensure the new child did not have the disease. The doctors simply performed one more test to see if the embryo was a match for Zain. But Charlie Whitaker's condition is not usually inherited, so there was no reason to test the embryo for the disease. Dr. Lana Rachitsky, a doctor at the Chicago Institute that treated the Whitakers, doesn't understand why the procedure is so controversial. She said, "We're not creating anything new. We're just trying to choose between the embryos to find the one that's normal and can save the life of its sibling." A spokeswoman from Comment on Reproductive Ethics, CORE, disagrees. CORE believes that the designing of a child as a tissue donor for a sick sibling is undesirable, unnecessary, and that the current decision-making process is profoundly undemocratic.